Hi.
Okay, so we are from group 6A. So our group will be presenting on diabetes mellitus in dogs. So please introduce yourself, guys.
Okay, so my name is AHMAD ZULHUSNI, BITI RANI, base metric number 192242.
Okay, I'm NAWAL AMANI with matrix number 192258.
I'm CHING, matrix number 193795.
I'm FAHDHLIN FAHMI with matric number 192337.
I'm BINTI, matrix number 192988.
Okay, next. So this is our patient segment. So basically we got 9-year-old mongrel dog, which is a female. The dog is properly dewormed and vaccinated. Next. So from the history, the dog was presented with polyuria, polydipsia, and polyphagia, which is excessive urination, frequent urination, polydipsia, excessive thirst, and also polyphagia, which is excessive hunger, which is always being hungry. And then the dog also shows fatigue, weakness. There's also weight loss and also diminished eye vision. So I think next, I will move on. I will give to the next presenter.
Upon physical examination, the dog has normal heart rate, which is 142 beats per minute, and tachypnea, 65 breath per minute, with mild cachexia, dehydration, congested conjunctival mucous membrane, and also it has mild bilateral cataract.
Okay, next.
Okay.
So next is the hematobiochemical parameters and urinalysis using URS10 HI strip. So this, okay, so these are the parameters. So as you can see, most of the parameters are normal. You can see the hemoglobin result are normal. The TEC and TLC are also within the normal range. The percentage for neutrophil, lymphocyte, monocyte, basophil, and eosinophil are also within the normal range. The platelet count is also within the normal range. The total protein, which includes albumin and globulin, are within the reference range. But there's markedly increase in random blood sugar, and also there's increase in the liver enzyme, which is ALT and AST. Next, the urea and creatinine are normal within the reference range. So we go to the next parameter, which is the urinalysis. So in the urinalysis, there's no present of urobilinogen, and bilirubin is not present. But the ketone bodies is very high, which result in 4+. The blood is not present. There's a little bit of proteinuria, which is the protein is present in the urine with 2+ from the result. And nitrate and leukocytes are not present, but the glucose is very high, which is 4+. And then the specific gravity is 1.060 and the pH is 6.5. So we go back to our hemogram, and then we'll see about the rise in the sugar in the parameters that I've said before. So I'll pass to Yi-Ching.
In my part, I will be discussing with you all about the random blood sugar. So actually, this parameter is measured regardless of when the patient last ate. And then in contrast with the other parameter, which may be commonly used, is the fasting blood sugar, where our patient will be fasted for 6 to 8 hours before the blood is taken. So in our case, the random blood sugar is very high, 526. So this shows that the dog is suffering from hyperglycemia. And in our case, because the dog is successfully treated with insulin treatment, so with that we can rule out type 2 or insulin or non-insulin dependent diabetes mellitus. So this dog suffered from type 1 or insulin dependent diabetes mellitus. For type 1 diabetes mellitus, it can be due to genetic predisposition, immune-mediated pancreatitis, or any infections, which can cause damage to the pancreas. So when the exocrine or the endocrine cells of the pancreas are damaged, there will be less beta cells to produce insulin. And over time, when the damage becomes chronic, I think there will be a lot of fibrous tissues to replace the damaged cells. So there will be causing even less insulin production, and there will be a low insulin in the blood, causing less insulin to bind to the insulin receptors in our body cells. So there will be impaired transport of blood glucose into our body cells to be stored or utilized and accumulates in the circulation. So I think that is why we have hyperglycemia in this case.
Yes.
Okay, so next I'll continue with the liver enzyme, which is ALT and AST. So as we can see in the hemogram, the ALT and AST concentration is very high compared to the normal range. So this increase in liver enzyme in the bloodstream would indicate that this enzyme has been released by the liver from result of a liver damage. And so to relate how diabetes mellitus can affect the liver and cause liver damage is when the level of insulin decreases, there would be a counter-regulatory hormone like glucagon, catecholamine, cortisol, and growth hormone. So this hormone will stimulate the enzyme hormone sensitive lipase, or HSL. So HSL will break down peripheral lipids into free fatty acid, where they will transport to the liver and be oxidized. So in normal cases, insulin would limit the oxidation of fatty acid. But in diabetes mellitus, since there's a deficiency in insulin, the excessive oxidation of fatty acid would lead to production of ketone bodies. So if this condition persists, it would lead to other damage to the other parts of the body system. And one of it is the liver. So when the liver is damaged, it will cause a leakage of ALT and AST into the bloodstream. And since this enzyme have a short half-life, which is about 22 hours in dogs, the elevation of this enzyme based on the hemogram might indicate that the liver damage is a recent condition. And one more thing I would like to add is that the parameter that shows the increase of ALT and AST might be mistaken from muscle trauma injury, because muscle can also produce AST. So how we can eliminate the differential for muscle injury is that in this case, you can see the AST is lower than the ALT, although both are increased from the normal range. So in muscle trauma, AST level would be proportionally higher than the ALT. So in this case, we can rule out the muscle trauma injury and confirm that there is a liver injury causing this enzyme to leak into the bloodstream.
Agree, yes.
Okay, next.
Okay, so
On
next.
to urinalysis.
Okay, moving on to the urinalysis. It seems that the ketone is very, very high, which is 4+. This can be explained in the case of dog with diabetes mellitus type 1. There will be low, low or absence of insulin, which then will stimulate the other counter-regulatory hormones such as cortisol, growth hormones, and catecholamines. And glucagon will increase to break down triglycerides and stimulate gluconeogenesis. So increase in glucagon will stimulate the conversion of free fatty acids into ketone bodies such as acetoacetate, beta-hydroxybutyrate, and acetone. So simply said, dog with diabetic mellitus type 1 will undergo fat metabolism, in which fat is used instead of glucose for energy production. So this will result in the production of ketone bodies in large amounts exceeding the amount that can be metabolized by the tissue and then infiltrates into urine, and in excess of tubular resorption then results in ketonuria. As there is a low renal threshold for ketones, ketones will then leak into the urine before they accumulate in the blood. So that's how ketonuria happens.
Okay.
Okay, next.
So for proteinuria is one of the abnormality findings in diabetes mellitus. So normally you will find protein in urine because of coming from the lining of the renal tubules or kidney, or maybe caused by the urine volume itself. But if we want to rule out some of them, maybe it's because the protein as shown from the table is like 2+, so we can rule out the glomerular leakage because we can see that the parameter from the hemogram show that the creatinine and the urea level is low, so most probably is not because of the kidney disease. And since the protein is around 2+, so we can rule in that the protein is coming from the breakdown of the urinary tract lining. And since the dog has having the polyuria and polydipsia, so the dog is suffering from high urine volume. So this is not the protein is not properly due to the low urine volume, and conformation of the proteinuria can be determined by the ratio of the protein to creatinine. So the total protein is around 5.45 and the creatinine is around 1.12. So it's like, you can obviously see that the UPC ratio is more than 1. So I think that the protein is most probably coming from the breakdown of urinary tract due to the dog is keep urination and caused by the polyuria. So next we pass to glucose.
For this patient, we can see very significant glucosuria, which is 4+. I think it's directly related to the hyperglycemia we mentioned earlier. So in this patient, which is diabetic, there will be high levels of glucose exceeding the glomerulus into the glomerular filtrate. So, and in a normal dog, most of the glucose will be reabsorbed by the epithelial cells of the proximal convoluted tubules. But in this case, because there is too much of glucose in the glomerular filtrate, so the filtration of glucose exceeds the renal threshold that the tubular cells can absorb. Therefore, a lot of glucose will be excreted into the urine, causing glycosuria. And then over time, hyperglycemia can also lead to diabetic nephropathy, which can also cause glucosuria because of glycosylation of the glomerular proteins. But then in this case, this is less likely because the renal parameters are still normal. Our blood urea nitrogen and creatinine is still normal.
Yes.
So I think it's mainly due to the hyperglycemia.
Yeah. So next.
So from the specific gravity, you can see that the specific gravity is very high because the normal specific gravity for the dog that can concentrate the urine is around 1.025 to 1.035. But we knew that the specific gravity is most affected by the soluble substance such as ketone protein and the glucose. We can see that from the other parameters that show that the ketone and protein and glucose are high in amount, show the very high positive. So I think that the dog is suffering from high glucosuria and the proteinuria. So the specific gravity is higher than extremely higher. Although this dog having the polyuria and polydipsia, but normally with the high amount of urine will have the decreased specific gravity, but we don't see in this dog. So most probably the amount of glucose and protein and ketone is too high until the specific gravity is 1.060.
Makes sense. Yeah. So for the epidemiology, usually type 1 diabetes mellitus occurs in dog, and type 1 diabetes mellitus is insulin dependent. It is most common in middle to older age dog. So the predisposing breeds are the Samoyed, Schnauzer, and Poodle. But the low risk breeds to get infected with diabetes mellitus is Boxer, Golden Retriever, and German Shepherd. So we'll move to the next slide.
Okay, so next I'll continue with the epidemiology. So other factors that could lead to diabetes mellitus is immune destruction of pancreas and also chronic pancreatitis, where this will lead to a reduction of production of insulin, like what Ching has explained just now. So the reduction of insulin could lead to progressive diabetes mellitus type 1. And then for the last point, Betty.
So for the hyperarthrocorticism or Cushing disease, also one of the epidemiology, because the Cushing disease will produce cortisol if the dog is under stress, and it will produce a hormone called cortisol, or we can also call glucocorticoid. So this will stimulate the gluconeogenesis in the liver, and it will lead to the hyperglycemia. And besides that, the Cushing disease and hyperarthrocorticism also can prevent the dog from having reaction towards the insulin.
Okay, then lastly, for prevention and treatment. So firstly, we can treat by giving an insulin injection, but care to be taken that we cannot and must not overdose the insulin, because this could lead to a rapid decrease in blood sugar, which would create other problems like cerebral edema and danger, especially dehydration towards the patient. And then we can also treat the underlying disease, like I said previously, the chronic pancreatitis, to improve insulin production, and also exercise to increase general well-being and also improve the immune body system.
Okay, next is IV fluid administration. We can give IV fluid to rehydrate the dog, and as there may be electrolyte imbalance and ketoacidosis may lead to metabolic acidosis. So, and lastly, dietary modification. Dogs with ketoacidosis must be fed with low-fat diet, high protein, and complex carb and insoluble fiber diet. We should not give high-fat diet because high-fat diet will stimulate more fat metabolism, and it will worsen the ketoacidosis problem.
Okay, so do you guys have any opinion about our presentation today? Like anything to add on or anything to discuss maybe?
Actually, I got something to add on. In this case, right,
Okay.
we measure the hyperglycemia in our mongrel dog using random blood sugar. And then this parameter reflects the glucose concentration at the time of blood sampling itself, because it's just blood sugar. But then actually, as Doctor mentioned earlier, we have another two important parameters to diagnose diabetes mellitus in dogs, which are, firstly is the serum fructosamine, and secondly we have the glycosylated hemoglobin. Glucose itself, they can bind to many structures, for example like protein or carbohydrate, through the process called glycosylation, like we mentioned earlier in our discussion. So for serum fructosamine, this is when the glucose binds to amino groups on the serum protein. So the fructosamine's half-life will be dependent on the half-life of the serum protein. So this parameter, serum fructosamine, can be used as indicator of blood glucose concentration. Compared to our random blood sugar parameter, this serum fructosamine can reflect our blood glucose concentration over a longer period of time, because it is bind to serum protein, which has a longer half-life. And then the second parameter that we can use is the glycosylated hemoglobin. Before this, serum fructosamine, it is bound to serum protein, but in glycosylated hemoglobin, the glucose is bound to our hemoglobin. The advantage for this parameter is that it is not affected by stress or anything that is eaten by the dog, because the random blood glucose will be increased when the dog is eating, and when the dog is not eating, it will drop. But glycosylated hemoglobin won't. So it shows the average blood glucose over a longer period compared to random blood glucose and also the serum fructosamine. But then the problem is, because the lifespan of the erythrocyte is very, very long, like in dogs is 110 days. So it may not be the most effective parameter if we want to know like the current chronicity of diabetes mellitus in our patient.
Yes, I agree with you.
So
So can we go to the physical examination? Can we go to the physical examination slide?
Okay.
So in physical examination slide, it said that there's like mild bilateral cataract and right. So like, do you guys know how, like, from the the patient is having diabetes mellitus, and then it has like mild bilateral cataract, which
I think
someone tell me why.
the dog is already very old, because like more than 9 years old. So maybe it's affected by its own age. No.
It doesn't like
metabolize the glucose.
It doesn't
properly.
include with the.
I think it's more affected by its own age compared to compared to diabetes, for my opinion.
Or maybe like in the case of like diabetes also, because just how we say glucose can bind to many structural organic materials in our body. So maybe I was just thinking the glucose can bind to the glycosylation to the ocular structural proteins and also the ocular vessels, so it can cause like osmotic damage to the lens and cause cataract. Maybe lah, I was just guessing.
Maybe also affected by the dehydration also.
True.
Yes. Okay. Also, any more, guys? Anything more? Let me see. So the prognosis for this case is,
according to the case that we got the article, the problem is after the insulin therapy. So I think the prognosis is good to excellent, in my opinion lah. What do y'all think?
I think so, because it's mainly due to decreased production of insulin. So since the treatment is injecting exogenous insulin, so that will help alleviate the condition of the diabetes, I think.
yes. I think I agree with both of you, because this dog doesn't really have like severe cases. Like, for example, some dog with diabetes will also affects the kidney, also affect the kidney, like diabetes nephropathy, right? But this dog doesn't have that, so I think that's why the prognosis is good to excellent, because it doesn't have any other complications rather than just insulin production.
And we also can see from the leukogram is like normal compared
most
to
of
other.
them are normal. Yes. I agree.
So this dog is depending on the insulin treatment for life.
I'm not sure about that. What do you guys think?
If it depends on insulin for life, then it will also depends on the patient compliance also lah.
I agree with you. If the owner is like lazy or whatever, didn't give insulin, then the dog will be.
Any more to add, guys?
Not
I think
from
that's
me.
all from me.
Any more from Nawal, Betty?
No, I think.
No.
I think that's all from us.
Thank you.
Thank
Thank you.
Okay, thank you.
Thank you.
Thank you,
I hope the
guys.
discussion is fruitful.
Yes, for all of us. Thank you, guys.